spinal decompression system is another solution for the therapy. Last years, the surgeon was orientated to give the surgeon in most kind of problems of the spine. Today, we can consider the possibility to give to the patient more choice. For example, if you have a severe herniated disc or a several discopathy with the classification of femur that I said during my relation, we can choose in cooperation with the surgeon what is better for the patient, because we need three aspects before to start of the surgery: the clinical, the diagnostic, and the symptoms of the patients. No? If we can see that there is the possibility to preserve the patient without the surgery, we can go a good solution with the spinal decompression system. But spinal decompression system is important because it's useful with all over our devices. The secret is the fusion for all over BTL devices, because every device gives an effect in the patient body.
In our clinic, we have treated about 250 patients, all in 1 year with the spinal decompression. We have treated a general low back pain, and most of them has herniated discs, protrusion disc. A lot of has scoliosis. A lot of people also has arthrosis and low back pain, but also we have treated neck pain and herniated and protrusion discs in the neck.
For my clinic and for my practice, the common patients that I use spinal decompression are those patients having back problems, whether it's for the lower back or for the neck area, whether it's a radicular or a radiculopathy for patients with a back pain that has disc problems or stenosis, and also for patients with acute muscle strains, whether it's in the lumbar area or in the neck area.
The most common indications are disc herniations in lumbar part of the spine, but also the cervical. There is a different degree, like protrusion, extrusion, spinal stenosis, also spondylolisthesis first degree. So we have some of the patients with myelopathy in cervical spine. We have a different diagnosis for decompression.
I think so that the main indication for this system is the problems with the lumbar spine, and also with another part of the spine. And also we can use it, for example, for big joints. So I think so that it will be very impressive for the patients who has problems with musculoskeletal system.
Spinal decompression system and a rubber device give the solution for all kind of patients with spinal problems. We are making a new way to work, a new kind of work, a new methodics, give a solution fast. Actually, we're resolving the 87% of our low spinal problems in our study, in our clinic. But in the two surgery comes just the 10%. It's a success for us, you know? Only 10% to surgery and might be around 90% with physical therapy resolving this problem. This is the very, very important result for us.
Of these 250, 88% has a good result after the treatment. Normally we did 10 sessions of spinal decompression, and we also combine this treatment, this decompression, with another kind of resource or technical, like using, for example, superinductive system or high-intensity laser or even shock waves therapy or TEER therapy. We always combine both therapy, spinal decompression and physiotherapy, because we think in that way it's more effective because the patient can feel the result in a short term.
Well, this is a good venue for people coming from all over the world to share the experience with the use of the BTL's spinal decompression system. Not just the spinal decompression system, but also with the use of other BTL equipments. So we can share ideas, we can share our experiences with regards to patients' response and patients' outcome to treatment with the use of the spinal decompression system and other BTL equipments.
About 18% was very good. We didn't have any negative effects. The most important to try before the surgery everything, and this is by our experience the best way. And the difference and with other decompression therapies, I think the most important part is how gentle it is and how targets the spot there is the problem.
This device takes a concept that we make in the old Greece. Hippocrates is the father of medicine, and Hippocrates speaks about the traction therapy to resolve some problems on the spine. BTL today renew what story tells. Every detail is controlled by the therapist. The angles of the bed, or the strength of traction with the body, or the possibility to work on the spatially district, spatially disc. You can traction that disc with the spatial angles, and everything is in total security because every detail was developed by BTL. For me, this device is the future.
There are the worldwide positive outcomes of the use of this system. I think so that it's very perspective and it will be very positive for our patients, mainly these with problems with spinal cord.
Today was important to the sharing the worldwide experience of the spinal decompression system, because in every country there is a different approach with the devices.